Absolutely. I mean, I think that sleep apnea for the last 2 decades has been a well-established independent risk factor for cardiovascular disease, and there are many studies that have shown that sleep apnea is an independent risk factor for stroke, for arrhythmias, for sudden cardiac death, for atrial fibrillation, for myocardial infarction. But unfortunately, in the recent few years, the clinical trials that were trying to treat the sleep apnea condition with CPAP, continuous positive airway pressure therapy, did not reduce the occurrence of some of these events. So it's a little puzzling because we've shown that it is a risk factor for cardiovascular disease, but when we treat it, it didn't really make the impact that we were hoping for it to make. So we're in a state of a little bit of confusion, and we're really trying to dig deep in terms of the mechanisms as to what it is about the obstructive sleep apnea that was causing this increased risk factor. So I think the awareness is there. It may not be as prominent as it is for diabetes, but I think it has been well known. But currently we are a little bit perplexed because of these data from clinical trials. It's not really confirming what we thought should have been the case. And so that's where we're at right now. But clearly there is a connection. It's just not clear as to how much the degree of sleep apnea severity, as my work has shown, the duration, how long have you been having sleep apnea that's been undiagnosed, and all of the other comorbidities. So obesity is a bigger driver of some of these events, and if you're not obese and you have sleep apnea, do we need to treat you, is a question that we don't really know the answer to.